Hi guys, it's Tara Scott from Revitalize. So I read an interesting study this weekend, and it said that there was a study done on the Seventh-day Adventist, which is one of the groups that is what we call the blue zone. So they have health habits that make them one of the zones in the world that has longevity. So what they found when they studied them is that people who drank milk actually had an increased risk of breast cancer. So most of this was in postmenopausal women. So they said that as little as 1/4 to 1/3 cup of milk daily increased breast cancer by 30%. And 1 cup a day, the risk went up to 50%, and 2 to 3 cups a day, 70 to 80. Now, this was published in the International Journal of Epidemiology. I'm keep looking at my notes here. So, but what's interesting about this is the critics will say that's not a randomized controlled trial. So basically it's an observational trial, which means whatever the intervention is or whatever the thing that they're studying is, the person in the trial decides on their own whether they're going to drink milk. So they say that it's not necessarily as pure data as randomized, but does it matter? We're talking about a 70 to 80% increase in something that you can clearly just do if you're somebody who has an increased risk of breast cancer, if you have estrogen dominance, if you have fibroids, if you have endometriosis, if you have dense breasts, if you have BRCA gene. Why would you drink milk if there was an increased risk, if you knew there was a 30% or up to an 80% based on the amount of milk, even if it's not a randomized placebo-controlled trial? If there's an association, to me, I think it's pertinent. So comment below, do you guys drink milk? If you don't drink milk, what's your favorite form of dairy alternative? I hope you guys think about this and have a great day.